Kia ora koutou katoa. I want to start today by sharing some good news, which is not often the case in the 1 p.m. updates. Yesterday we hit 2 records. The most vaccinations administered in New Zealand in a single day, 56,843. So far, 72% of New Zealanders aged 40 plus are either booked or have been vaccinated with at least 1 dose. This is great progress. Over 150,000 vaccination bookings were made yesterday too, which is fantastic. Just a reminder, if you are 40 plus or in one of our other priority groups and haven't made your booking yet, visit bookmyvaccine.nz today and reserve your spot. And yesterday, we saw the most COVID tests processed in a single day, 41,464. The fact that we have achieved both these results on the same day is extraordinary and is exactly what we need to do, both to get on top of this outbreak, but also to prepare us for the future. But despite reaching record numbers, we do need to keep going. We need to test to ensure we can get an accurate picture of the perimeter of the virus. And we should also be using this time to increase our vaccination rates. I want to acknowledge everyone who has waited, in some cases, many hours to get a test. You are playing a key role in controlling this outbreak and helping us get back to normal faster. And you can see as a result, we have those record numbers, sometimes 10 times higher than what some of those areas are usually processing in terms of tests. But we do need to take the pressure off the system. We can do that by standing up additional testing capacity. Today, there are 14 community testing centres open across Auckland, including 4 new pop-ups which have been stood up overnight, of which Warkworth opened at 11 a.m. and Takanini will be opening at 1 p.m. today. In addition, 4 community testing centres for close contacts only are in operation today. These are sites that we're using for known contacts to ensure we prioritise their testing. One of the things we heard coming back was people who needed to be tested were waiting in those long lines. We need to move them through. So these are not sites that we are publicly advertising, but those who need to use them are being given the details to try and get them tested more quickly. And in Wellington, 6 community testing stations are open across the region, and this includes 3 pop-ups which were stood up overnight. Do visit healthpoint.co.nz to get details of COVID testing stations anywhere in the country, or call ahead to your GP to see if they have testing available. Our GPs are processing a large number of our tests, and often the wait times are much, much shorter. Just a reminder of who it is that we're focused on testing right now. There are broadly 3 groups of people. Those who are contacts of known cases. If you're called by public health, then you do need to isolate and get a test. The second are people who are at locations of interest on the dates and times recorded. You too need to isolate and get a test. If you went to a location of interest, but not on the date or time set out, then you don't need to be tested. And finally, those with cold and flu symptoms, please isolate and get tested. If you're not in one of these groups, and if you are well, you don't need a test. It is great to have these very high numbers of tests across the country. It gives us that greater sense of certainty. But at the moment, we need to ensure that those who are at risk of being exposed or who are unwell are getting tested. Sitting behind all this testing and vaccinations is an outstanding health workforce. This outbreak has particularly impacted on our frontline workers, even more so than in the past. On behalf of New Zealand, I want to acknowledge how tough the last few days have been and also say thank you. If you interact with a health worker in the coming days at a vaccine station or at a testing station, please pass on the thanks of the team of 5 million. I'm now going to hand over to Dr. Caroline McElnay, our Director of Public Health, to provide an update on case numbers and our source investigation. Dr. McElnay.
Thank you, Prime Minister, and kia ora koutou. Today, I can report that there are 21 new positive cases of COVID-19 in the community. That brings our total number of confirmed cases associated with the current Auckland community outbreak to 51. All cases have been or are being transferred safely to managed isolation facilities using strict infection prevention and control procedures. Of the 21 new cases, 18 are in Auckland and 3 are in Wellington, one of which we reported yesterday. Investigations into the source of these cases continues. 21 cases of the 51 are now confirmed as part of the Auckland cluster, with the remaining investigations still underway to confirm the specific linkage, but initial assessment shows that in the vast majority of cases there is a link. Public health staff are rapidly interviewing cases to establish how the new cases were infected and to determine further details of their movements, and we will continue to release that information as it becomes available. In addition to the community cases, there are 3 new cases to report in recent returnees in our managed isolation facilities. On whole genome sequencing, ESR continues to run sequencing from samples taken from the new cases. They've completed sequencing for 29 of those cases, including the 3 Wellington cases reported yesterday, and they are all genomically linked to the Auckland cluster. On contact tracing, our public health staff across New Zealand are continuing to contact trace with a focus on higher risk locations. That is a team effort involving the Ministry's National Investigation and Tracing Centre and all of the country's public health units, and they're working tirelessly to investigate the cases. Isolation in alert level 4 means isolating yourself away from other household members. So when contacts are identified and traced, it's important that they get tested and isolate until they receive a negative test result. The number of contacts has increased significantly. This is something that we expected as we identify more contacts and test in large numbers. As at 10 o'clock this morning, 5,065 individual contacts had been identified. This number will increase throughout the day as records are fully processed, and we expect to have another 5,000 contacts by the end of today. The majority of those contacts are located in the Auckland and Waikato regions, with a small proportion located in other areas throughout the rest of the North Island and South Island. As at 10 o'clock today, 1,982 contacts were located in the Auckland and Waikato regions, and 266 contacts located throughout the rest of New Zealand. On locations of interest, we are working around the clock to get further details of the movements of cases. We have been hearing concerns about the time it takes to get some locations of interest published. This is a very fast-moving situation, and we do need to make sure that not only do we get information quickly, but that it is correct and accurate, and that can take time to confirm. Also, our contact tracers are dealing with people who've just been advised that they are a case, and they're often very stressed, and so it can take time for people to recall exactly where they've been when they're under pressure. Whilst it does take time to gather that information, we are working as fast as we can to get that information out and to put the list of locations up on the Ministry's website as soon as it becomes available. Also, use of the COVID app allows push notifications to go straight to people who have been at those locations of interest. So that's another way in which we can quickly identify those contacts. I do want to reiterate that if you were at a location of interest at the specified times, please self-isolate and call Healthline on 0800 358 5453 for advice on testing. By calling Healthline for advice, people who've been at those locations of interest at relevant times are logged into our contact tracing system. That means that your swab can be tracked and processed faster by the laboratories. So please do call Healthline. I just want to talk about wastewater. We've had a detection of COVID-19 in a wastewater sample collected from Warkworth on Tuesday of this week. And so our message is anyone who has been at a location of interest at the relevant time or is symptomatic and is in the Warkworth area to get tested. A pop-up testing centre has been set up at 77 Morrison Drive, and this will be open until 5 o'clock. People are asked to call ahead on 09 425 8585. The wastewater catchment area at Warkworth is 3,500 people, and extra wastewater testing will be taken from Warkworth and Snells Beach today and tomorrow. Just on the general comment about wastewater testing, we have got 41 sites around the country covering 3.7 million New Zealanders. Of the 41 sites, 13 are in Auckland and 4 are in Wellington, with further sites also being added. There continues to be COVID-19 detected in wastewater in the Auckland region. Those samples were taken on Thursday. This includes the Waitakere region, the North Shore and Eastern Auckland. ESR expects to receive further samples later today from Auckland, Wellington and Coromandel. There have been no unexpected detections to report from a wastewater sample taken from other areas around the country. And just a bit about Metro Auckland hospitals. You'll be aware that the North Shore Hospital Emergency Department had been closed. It continues to be closed until further notice, with ambulances being diverted to other Auckland emergency departments. However, the hospital is open to direct primary care, medical and surgical admissions with a referral from a GP. On-site staff testing is now in place at North Shore Hospital for both symptomatic and asymptomatic staff. As at 6:30 a.m. this morning, 829 Waitemata DHB staff had been tested. All returned results were negative, and we still have 208 results still pending. 137 staff were identified as potentially being in contact with the positive patient at North Shore Hospital. 84 of those so far have returned a negative result. Of the patients who were in affected areas at the same time as the positive patient, 20 of these are still in hospital. All have been swabbed and their test results are all negative. Public health officials are closely monitoring the situation, and additional support is available for hospitals across Metro Auckland if needed. Back to you, Prime Minister.
Thank you very much, Dr. McElnay. As you can see, our number of cases have grown again, but given the large number of locations of interest and what we know about Delta, this isn't surprising. We have always said cases will rise before they fall. And based on the experience of overseas countries, we do expect cases to continue to rise through to next week before they start coming away. And it's always good for us to share what those expectations might be before we start reporting cases in the coming days. So we do expect them to increase. But there are actions you can take to make sure we don't create new cases or spread the virus in lockdown. One of the things we have learnt from New South Wales is that the virus can keep spreading during lockdown from people going to work or people breaking the rules of a lockdown and meeting up with other people, then passing on the virus. This is one of the key reasons their cases keep going up and their lockdown continues to be extended. And a devastating 825 cases have been reported in New South Wales this morning. No one wants an extended lockdown and no one wants to see that rate of transmission. So the number one thing everyone can do right now is reduce down your contacts and ensure you stick to your bubble. I especially ask that anyone who is a worker at an essential service, make sure that you do not go to work until you get a negative result, and employers have advised you of this too, if you are in those groups of people we've asked to be tested. This morning, I asked our public health team how our compliance was looking, and it was really heartening to hear that the people they are contact tracing are at home. That is exactly what we need. We just need to keep going, because that means eventually our locations of interest will eventually start to decline as we contact trace people who have been at home during their period of infectiousness. On locations of interest, I do have an update in addition to what has been shared by Dr. McElnay this morning. You'll recall that some days ago we talked about genome sequencing helping us to narrow the likely source of COVID to an individual who arrived in New Zealand on the 7th of August. We said at that time, though, that we're continuing to still keep some of our options open. That was because we didn't have a complete sequence, but it was enough to give us roughly 90% confidence in our theory. That sequence was then rerun, and we received the results yesterday. The results of that give us even greater confidence in the match. On that basis, a decision is being made to remove locations of interest that predate the 7th of August. We ask that everyone from those locations still, of course, comply with level 4 restrictions. So you still need to stay home, but you no longer need to report for additional testing. Of course, that decision has been made only recently, so it will, of course, still need to be updated on the locations of interest website. This is an example of how the science can help us narrow the public health measures that are needed in an outbreak. It was absolutely right, though, in a Delta environment for our public health team to be cautious in their approach till we had evidence to the contrary. Just a couple of quick pieces of information before we wrap today. We know isolation can impact on the ability of people to access food. If you're sick or cannot leave home to buy food, you can ask family, whānau, friends or neighbours to make a contactless drop-off of groceries to you. If you are delivering supplies to someone, remember to stay 2 metres apart and wear a face covering. Ideally, though, just drop things on people's doorstep and leave. You can also use your supermarket's click and collect service and ask a local friend, family member or neighbour to drop off the groceries for you. As I said, compliance and reducing contact is critical to stopping the virus spreading. Overall, though, compliance has been outstanding. We're seeing a similar level of reductions in traffic and movements as the last time that we were in level 4. Since Alert Level 4 came into place, 17 people have been charged with a total of 20 offences nationwide. Of the 20 charges filed, 11 are for failing to comply with the COVID-19 order, 7 for failure to comply with direction, prohibition and restriction, and 2 for Health Act breaches. In the same period, we've had 53 formal warnings issued. Police have also issued 70 infringements nationwide, including 61 to people who failed to remain at home and 5 for persons who failed to wear a face covering. And just a reminder, you do need to wear face coverings when you enter into an essential service like a supermarket. Overall, though, those numbers are really low, so thank you to everyone for sticking to the plan that we know works. Even if we know we have a plan that works, I know the uncertainty of these periods of time in lockdown are really tough and does have a real impact on mental health. Please do not forget to reach out to friends, family and whānau who may be struggling. A phone call, a video chat, a message all really helps. Local GPs are still working at Alert Level 4 and can provide advice on how to get help to support your mental wellbeing during this alert level, including phone and video consultations. You can also call 1737 for free to talk services, and that's with a trained counsellor. That's 1737. There is more information about how to access the range of mental health support services on the covid19.govt.nz website. Some of the online services there are absolutely fantastic. So please don't hesitate to look, and I encourage you to share that information with others. We are now happy to take your questions. Jessica.
Prime Minister, are you satisfied with the amount of time that it's taken to get those locations of interest on the official website? Because for a lot of people, there's a lot riding on when those pop up.
Yeah, of course, considering that we are in alert level 4, so people should be at home when they receive that information. It may just then give them additional information on whether or not they fall into a category of someone who needs to be tested, and or prioritising those areas where we may have essential workers affected because we need them to stay at home. But there is always a balance here to be struck. On the one hand, if you put up a first cut of information and it's incorrect, so for instance it has the wrong date or the wrong time, you can then have a whole raft of people enter into our testing system that we don't need to. So we're constantly trying to get that balance right, that we have enough information that we believe we can verify before we're putting into the public domain. The second thing to remember is that we are still reaching out to those contacts that we identify, sometimes before they're even up on a website. Our website is not the only way we communicate with contacts, which is a very important thing to remember.
How satisfied are you?
Well, we're going to break away from the news conference now, but you can keep watching on our websites, newshub.co.nz. So just recapping those key points from the Prime Minister and Dr Carolyn McElney. 21 new community cases of the COVID Delta strain were announced today, bringing the total number of infections in this current outbreak to 51. There are 3 new cases in Wellington and 18 in Auckland. COVID has also been discovered in wastewater testing in Warkworth, and a pop-up testing station has been set up. But there is some good news. There are no cases so far in the Coromandel or the South Island. A record 56,846 vaccinations were conducted throughout the country yesterday. That's a record. And 5,065 contacts were contacted yesterday. Health officials are expecting to contact another 5,000 today. Plenty of numbers there. Well, I will be back at 6 o'clock with a full wrap of the day's developments. I'm Tom McRae. Good afternoon.